Hello, everyone. It's my pleasure to welcome everybody to tonight's webinar. My name is David Bomshot, and together with Jason Fisher, I serve as co-chair for the RFS Communications Committee. On behalf of the SIR-RFS section, thank you for taking your time tonight to hear this webinar on the effective communication skills, which is session 2 of our RFS leadership webinar series. Before we begin our session, I want to remind everyone that this webinar will be recorded and will be available on YouTube by searching IR Education. Feel free to ask questions at any time. You can enter them into the chat box on your GoToWebinar control. Also, please check the RFS website regularly for any upcoming events. Follow us on Twitter, Facebook, Instagram, and also Figure One for other updates and posting of clinical material. Without further ado, it's my pleasure to introduce Alex, who will introduce our speaker for tonight.
Good evening, everyone. My name is Alex Logston. I'm an ESIR resident at Present St. Francis in Evanston, Illinois, and I'm filling in for Monica Uceda, the former Women in IR Chair and incoming Medical College of Wisconsin IR Fellow. I would like to welcome all of you to the second session of the Leadership Webinar Series. This program's goal is to provide tools in strategic planning and problem solving, which may help trainees and early career physicians make significant contributions to their communities. The series will comprise of 10 online one-hour sessions centered around a variety of leadership topics such as negotiation skills, networking, mentoring, teamwork, communications, health policy and strategy, and work-life balance. Presented once a month by leadership experts in our field. Tonight we are honored to have Dr. Paul J. Rochon, Effective Communication Skills, The Danger of Silence. Dr. Rochon attended Louisiana School of Medicine, New Orleans, Diagnostic Radiology Residency at University Hospital's Case Medical Center, and fellowship at Miami Cardiac and Vascular Institute in 2010. Dr. Rochon is the program director of the Integrated IR Residency and VIR Fellow at the University of Colorado. As a fellow of the Society of Interventional Radiology, he is an active member of SIR, and he is heavily involved in IR teaching curriculum, development, and research. Dr. Rochon is an associate professor at the University of Colorado, and he was named 2018 Physician of the Year there. He is Director of Non-Invasive Vascular Imaging, Director of Diversity, Equity, and Inclusion for the Department of Radiology, and co-director of the Comprehensive HHT Center at the University of Colorado Health. Wearing many different hats and working with administrators, residents, fellows, attendings, and so many others, Dr. Rochon, we are excited to hear about your experiences and learn from you tonight. Thank you.
Thank you very much, Alex, and thank you to all who have joined the webinar and taken time out of their precious evening. It's my pleasure to talk to all of you about the danger of silence and some effective communication skills that are related to this. My disclosures tonight regarding this talk, everything is based on observational and personal experiences and a little research that I have on this topic. As Alex said, I wear a lot of hats. I'm very privileged and honored to be able to do that. And it's allowed me to learn a lot and observe a lot of positive and some negative experiences that confront all of us on a daily basis. Most importantly, in our work as physicians, working with patients first and foremost, our colleagues and co-students, residents, attendings, and also administrators. So first of all, what's the key to communication? I believe that we just need to do it well. And it has a lot of other things that are involved with it, which it's a little too broad for this evening's topic. It can make you and break you. Little communication, too little communication, and too much communication can actually do that. And what I found is any mistakes in communication or lack thereof could mistakes in patient care administration, education, and life. So what are the benefits of silence? It allows you to think before you speak. It allows you to breathe so that you feel comfortable whenever it is you have that opportunity or you take that opportunity to use your words and speak. It allows you to listen We all have been told that you cannot listen when you're speaking. Some people have that superpower, but most of us can listen a little bit better. And it allows us to hold attention to what is actually being said. We've heard this phrase, silence is golden. Well, is it necessarily golden? In certain situations. We all feel more comfortable whenever we're talking. That's just an act of life. And we feel that if we're saying something, then we don't feel as vulnerable whenever we're quiet and listening. And it's risky to leave our words out there without explaining or defending them. Therefore, we just keep talking and talking and talking instead of listening. One thing else, I know that the title of this presentation is The Danger of Silence. We'll get to that in a second, but I wanted to look at the other aspect. Silence can be confidence. We may think that silence makes us vulnerable, but in the end, it may project a confidence in refusing us to be rushed, refusing us to say something that we don't want to say or we don't mean to say. Allows us, again, to think about what we say because it can have a large impact, again, on our career and on our patients and fellow colleagues. Silence can provide an opportunity as well. It allows others to think of what they may want to convey, and it may prevent you from rescuing them. There are instances where we feel that if someone is silent for a minute, or whenever we're talking and someone is silent and you know that they know what they're talking about and they just can't find it, you may give them a little hint to get where they need to be, but sometimes allowing them to do it on their own will allow them to better effectively communicate, and as opposed to just saying it for them. It also creates space in your effective communication and not to clutter anything so that ideas and actions can actually be made. Silence can also allow you to reflect on things that are important or things that may not be that important as you go ahead with your action plan. So what about silence dangers? People don't hear you. That's what sometimes we think. You definitely need to be able to advocate for yourself, as we will talk about later on in this presentation. Silence can be misused to hurt or punish, but that's not our intention. It should not be our intention, as in the silent treatment. It doesn't get us anywhere. We hear this a lot, especially in our profession, whenever we're sitting in multidisciplinary conferences, within rounding, you name it. It's who wants to have the last word? Well, what's the reason for this? It's the game of one-upmanship. Now, I would say that if it depends upon your patient, you're putting your patient first, you're advocating for your patient or someone else, then go ahead and do it. But if it's just to find a winner in this situation, really no one wins. Your communication should be an exchange of information, ideas, suggestions for something better. The last word may just provide division rather than unity. Nonverbal communication, some may look at, well, is it silence? It may be, but about 93% of communication is nonverbal when we think about it. Our tone is affected, posture, gestures, facial expressions, volume. These are all things that we will touch upon later and that trainees and also early career physicians can use in our interviews and other ways of promotions in life. In this day and age of a lot of nonverbal communication, or I guess non-vocal communication, where we're emailing a lot, we are texting, we're not really picking up the phone and speaking to people as we did maybe 10, 20, 30 years ago. So I wanted to talk a little bit about, as you go along with speaking about different situations, policies, logistics, operations, be aware of the angry and emotional replies. There are going to be times when you don't necessarily agree with something that is delivered to you, but it's important not to respond quickly. to really digest and reflect on what needs to be said. So take a break. Unless it's an emergency, you need to reply, which 9 times out of 10, you really don't. If it is an emergency, they're going to contact you directly. Take a break and just figure out what's going on. Don't jump to conclusions. Even though it may emotionally affect you, take that break. Whenever you are going to reply eventually, keep it brief. I've learned that if you get an email later at night, whenever everyone is pretty much catching up on their day, you may want to just sleep on it. Maybe jot it down on paper, place a reply email in your draft box, but don't send it, and see how it affects you the next morning. Be straightforward with your reply. It's really important not to beat around the bush, but just tell it like it is, and that goes along with keeping it brief. And before you do all of this, while you're taking the break, ask for advice or suggestions. Everyone has a safety net, whether it may be a significant other, a colleague you can really confide in, a mentor that you can also always reach out to. That's really important because either she or he may have been through that situation before, and they can allow you not to make the same mistakes that they have made in the past. Practice patience for silence. It's not easy, and that's why a lot of people don't do it. I've researched that we should take about 15 seconds before we are actually saying something. Now, that is a long time in this day and age because we have communication tools at our fingertips with texting and things like that. But if you allow yourself to, again, give yourself 15 seconds. One good example is whenever we are doing a case or rounding or at the bedside teaching. I can remember when my attending would be asking me a question, and I felt that I needed to answer quickly. Well, I tell some of my students that, give yourself some time to answer. If we're in the middle of a case, I don't necessarily need the answer right now. So don't rush into it. One of my prior attendings also used to say, whenever you're asked the question, repeat the answer with the question. And that gives you some time to also think, because all of you know the answer. You have been working very hard and you will continue to work hard in your career, learning every single day. So just take your time to do that. One other thing that one of my mentors used to tell me, don't have diarrhea of the mouth and constipation of the brain. I'll let you just relish on that. So when to speak up? Let's really switch gears and the danger of silence. So when your words will affect someone or something in a positive way, that's what we should be aiming for. And again, about 80%, 75% of our day is working with, for, advocating for our patients. Now, we will have those difficult conversations that will require both verbal and nonverbal communication. So both of those are equally important. You need to speak up when you need to say your truth. That's really important as being advocates for yourself, or if you feel that something just is not right, then you should speak up. Silence, that's the danger of silence at that point. And whenever, again, you're advocating for others and specifically yourself, which is what we're going to get into next, because this is something that all of us need to practice. A lot of us are introverts. We probably will not come out and ask for things that we actually not necessarily deserve, but we actually need and we want as we move forward, and we are qualified for that next step. So how do we advocate for ourselves? First of all, we all need to go in this process believing in ourselves. If we don't believe in ourselves, there's no confidence, and someone will say, well, why should I promote you? Why should I give you this opportunity? Well, you need to go in and seize that and know that you already are worthy of that opportunity. A lot of things are not given to us. We work really hard for them. You have to leave the emotions at home. Going into situations where you may not feel right, then you may not be ready to go up and advocate for yourselves. That's whenever you talk to that significant other, you talk to your mentor, you talk to whoever you can confide in, and leave those emotions at home. There's certain conversations that, especially in your career, that you don't want to have emotions for. That doesn't mean that you cannot have them, but it's important to sometimes leave them at home, especially when you're advocating for yourself. When you're going up against something, you have to back it up with big data or lack thereof. Whenever you're asked the question, you need to definitely have information that can say, well, this is why I'm saying this. In interventional radiology, we're looking for more data. And that's why we want more randomized clinical trials. We want more research out there, and we're doing a better job at it. And if there's a reason why you need or want to go for something, it may be because there's not enough data. Well, do your research and prove that there's not a lot of data, because that's how we're going to push medicine. That's how you're going to push yourself. Before you go out, you enter that door or enter that meeting with whoever you are advocating yourself to. You need to have your plan, a strategic plan, have your mission statement. Why are you doing this? Your action plan, 1 year, 5-year objective, short and long-term goals. You need to have your own vision statement, because a lot of times people will ask you why you're doing this. And what do you expect to get out of this? You may not know. Things may change along the way, but you have a plan. And just as you have a plan for your procedures and your cases that you approach, A, B, C, and D, if this goes wrong, then this, then the person who you're advocating to will say that you have it laid out. So why should I not give you this opportunity? It's something that they don't have to think about, and that you can actually take it and run with it. Ask for more and not less. This is something that you can ponder on and just say, well, am I going to be greedy? It's not talking about that. It's you need to make sure that you ask for as much as you can possibly handle. That you need to be honest with yourself with that. But that time that you advocate for yourself may be the sole opportunity. Now, hopefully you can go back and relook at your plan and revisit it 6 months, 1 year, 5 years, and you may be able to renegotiate things. But usually whenever you're out of the gate, that first opportunity, you want to ask for as much as possible. It doesn't mean that you're not going to get it, that you're going to get it, but that's an opportunity to ask for more. And it may allow you to realize that maybe that's not what your goal is. No, it's not your final answer. You can go back to the drawing board. You can go halfway back. You can go back and talk to someone who helped you think this out and see, well, why wasn't this the appropriate opportunity? Or why did this person tell you no? Now, it may not be the appropriate place for you to take your opportunities. You may need to walk away, and that's fine. But if you do have that same passion for what you're trying to advocate for, you can maybe take that someplace else. But hopefully, your employer, your directors, your bosses, chairmen, chairwomen, chairpersons, whoever is actually sitting on that other side, they will see that you have everything together, and you will be an asset or continue to be an asset in the workforce and for your patients and for that institution. Some take-home points. Words can be dangerous. We may need to make sure that we use them appropriately. Silence can be dangerous. We need to use it equally appropriately. We all need to hear what is being said. We need to make sure that you advocate for yourself. And this is something that you need to continue to do every step of your life. We, as professionals, as physicians, practicing our trainees, we advocate for our patients. That's what we're being trained to do. And sometimes we can take the back seat in terms of advocating for ourselves. And remember that this is a lifelong process. This is something that you will have multiple experiences. You're not going to be an expert at this. I don't claim to be an expert. I learn every single day by trying to listen a little bit more and trying to have a little bit more silence. Trying not to get on my soapbox all the time. And if I am going to speak, make sure that I'm speaking my truth, making sure that you are actually effectively delivering communication. One, through your handoff process that is so important in your day-to-day life. We're still using it as attendings. We're still using it as faculty. And that's why it's so important in your training programs to deliver have a seamless handoff process. Appreciate your attention for this short presentation, but I wanted to hit on different aspects of silence. It can be dangerous, but the lack thereof could also be dangerous. I will entertain any questions at this time. Thank you so much.
Dr. Rochon. Sorry about the feedback there. Dr. Rochon, thank you so much for your wisdom and time tonight. We have all experienced these situations, and it's great to reflect and understand how we can handle them in the best. Are there any standout experiences you have had regarding great communication or lack thereof?
Yes, there are several, and I'll lump them into one tip that I have for everyone. So I'll go forth with a question about experiences that may have led to effective or not effective communication. And I would have to say that it's all within patient care, because that's really the center of what we're doing every day and age. And I would say that whenever we do not communicate, we are dealing with a lot of multidisciplinary cases. As interventional radiologists, we are, I would say that we are part of the team. Sometimes we're the center of the team, and we are pulled many different ways. But one of the things that's really important is making sure that we have open communication with our patients and our families. Even though we're consulted for a procedure, and there are a lot of patients that I have in my practice who I'm not doing a lot for in terms of doing, let me rephrase that, who I'm not performing a lot of procedures. However, I have them coming into my clinic, following up with them, just as other physicians and other specialties may do. But we are really honed in on, well, what's the procedure that we're going to do? However, with having that open communication, having your patients know why you're not doing things and why you will do things, and making sure at the end of the day, whenever you are finishing with the procedure or have a difficult procedure, you go back and you talk to your patient. And this goes back to my training. One of the things that I usually tell my trainees is the procedure is not over until what? And I get answers such as until you dictate it, until it's billed, until you write the orders. No, the procedure is really not done until you talk to the patient. And that's where I see effective communication skills lie. Because even though you are doing a bread and butter port placement, that family member, that patient wants to know, well, what happened. It may be just going back to everything went well. It's okay to use your port and to answer any questions that he or she may have. And that's why effective communication skills go a long way. And talking about how do you utilize silence, sometimes just listening to your patient. A lot of times we feel as physicians that we know everything, that our patients are coming to us because they don't know everything. Well, our patients are coming to us with a lot of research, and sometimes the research that they do may not be all together, and it's up to us to listen to see, well, where they're getting the information, where have they come from, why is this patient here frustrated with you and frustrated with the situation? Bounce through the different the medical system, and until they have a chance to just express themselves, and they may be emotional. This is where we like to talk a lot. You listen to them, and then you present them with ideas or suggestions. So I would say that in my experiences in my career, that has been the patients have been the best teaching tools and opportunities for effective communication.
That was a great answer. I specifically liked how you said, it doesn't end until you speak with the patient. I see over here a question in the control panel. Someone posted about how do you deal with patients who are, forever Googling and don't trust you? And how do you deal with such patients effectively? Do you have any comments on that?
Yeah, that's a great question about our patients just trying to find information. And um, it's not uncommon for patients not to trust medicine because of some things that we really haven't done well. It's not our fault, but we represent what's out there as well. And a lot of the information that is disseminated, again, we have no control over. But what we have control over is one, listening to the patient and asking them, well, allowing them to continue to answer their questions. And if you can supply them with data or lack thereof, then I think that goes a long way. Those patients who are forever Googling, do not trust you, the most important thing to do is to have them sit in front of you in your clinic, sitting down next to your patient in the hospital whenever they're in the hospital bed and when they have their family members, because their family members are advocating for them, and listening to them. If you listen effectively, your patients will not have to Google as much because you are allowing them to speak and then you're speaking. When you're speaking above them, then they may not trust you. Some of them feel intimidated. When you're a patient, you're in a very vulnerable state. And there's some reasons in history that patients may not trust. And that's why it's up to us to make sure that we're delivering we're listening. We're striving for more diversity and inclusion across healthcare. We're treating healthcare disparities. This is the way that we can try to get our patients to come to the table and listen to us. And they may not trust us, but we're doing everything that we possibly can.
Thank you, Dr. Rochon, for the great answer. We have another question here from the control panel. And do you have any networking books that you would recommend?
Unfortunately, I don't have any networking books at this point. A lot of the things that I gather are from like leadership things, leadership workshops, and honestly through experiences. If I come across any, I can definitely send it through RFS, and we can post that. But I don't have anything specifically right now.
Great, thank you. And I know you have a lot of personal experience in leadership positions. What were some of the motivating you to accept the program director position for not only the IR residency, but also the VIR fellowship? And is effective communication something you assess during these interview processes?
I'll back up. What motivated me to become program director? I have a passion for education. I think it's a privilege to be able to educate the next generation. And I learn a lot from everyone who I mentor and educate. And that drives me every single day. It allows me to stay up on my game because if I'm not trying to educate someone, then I'm not learning either. And I want to just hone in and be an expert at my skills. I began as a fellowship program director because it's really intimately associated with IR. And now that we have the transition to the residency, approaching our last year of fellowships, The reason why I wanted to become the integrated residency program director is um, all of the advantages and all of the hard work that some of the pioneers who developed this residency, and seeing the impact that it can have for our sole specialty. We're no longer a subspecialty. Um, and I wanted to also utilize everything that we have in our fellowships and fellowship and education and transition that and make it to be even a better residency, and trying to do that on a national level as well, not only at my institution, but also across the nation, and helping other programs with and assisting with development of curricula and leading all the residencies. Do I look at effective communication within interviews? Absolutely. That's the reason why we interview. We want to see how you can, what are your interpersonal skills like? Do you have any at all? Because that is the one of the most important things that it's really hard to teach. I know that's what the networking books and the interpersonal communication. I mean, a lot of people have studied this, but until you practice it, you just don't know how to utilize it. So you have to put yourself in that situation. So yes, I do look at that, and I had the slide about the nonverbal communication, your posture, your tone, your volume, your facial expression. And it doesn't mean that you need to have a lack thereof. I want you to smile. I want you to be comfortable. We want to love what we're doing and be comfortable with our job. We will have many stressful situations on a daily basis, but it's important to be able to deal with those and overall have a positive vibe. You're not there in that interview because you don't want to be there. You're there because you want to get to that next step and you want to be comfortable with that. I know it's a very stressful situation on both sides, but my advice to those who will be interviewing in the future, or those who even have interviewed, to go in there with confidence, to go in there with your story, to go in there with your truth, and to sit up tall, smile, enjoy that moment, because that's a very short period of time that we're trying to extrapolate as much as possible from you. And you have those other opportunities, that interpersonal communication that you're having while you're waiting for your interview, at dinner, after dinner, whenever you're communicating with your program, with the program coordinators. All of that is really important. But the most important thing is being yourself, because if you're trying to fake something, then it's going to come out later on.
Thank you for the answer, sir. We have another question here from the question bank. This is more focused on our colleagues. Are there any tips for dealing with ill-tempered or closed-minded colleagues, especially if it comes to race or sexism?
Yes, those are things that we hopefully we don't come across as often, but we will. Um, I would ask for those that are close-minded, and there are different situations because of race, gender, sexual orientation. We're trying to build on those in terms of educating, giving modules, giving more workshops for diversity and inclusiveness, and how to work on that and make them more pervasive within institutions, and particularly our departments. They come in different flavors. They can be our patients, they can be our colleagues. Um, First, listen, and don't be quick to reply. A lot of these things will jolt you. You may become angry because it's discrimination. And one thing that you can do is, this is not right. I mean, every institution should be following the Equal Opportunity Acts. Every institution should be pushing forth with more diversity and inclusion. And you should talk to someone about this. Talk to your chair, talk to your diversity and inclusive officer. If you don't have one in your department, you can go outside and look into your institution, in your medical school. Look for that. There are offices, human resources, that you can actually look into and how to deal with these situations. But I would document first, because this may be a trend, and this will not further your institution's goals. And closed-mindedness doesn't actually further it. And I believe that institutions and programs that want to move forth and grow need to be open-minded and need to listen to others. Now, we may be able to listen. We have a lot of unconscious biases, and that goes along with closed-mindedness. We expect to deal with situations only with our own experiences, but there's millions of other experiences out there. And it's really hard for us to learn, but if we can take a moment, take a step back and listen to that person, we may be able to lead others and we can lead each other to something better. So to specifically answer that question, listen first, then upon asking that person, well, why do you feel that way? Just keep it open. They may or may not answer. And then you just document and take this to the next level and to talk to someone about this and then move forward in your institution. And I think this is something that we don't talk about enough, and this is the danger in silence. But I think if we speak our truth and if it's fair, then it's worthy to be said.
Thank you so much for that response, Dr. Rochon. There are no more questions in the gallery. If it's okay with everyone and Dr. Rochon, we can close the webinar for tonight. I would like to thank everybody for attending, especially Dr. Rochon for your time and your knowledge. I think this is a very important topic that sometimes we just need to reflect on and take the time to think about. If everyone is okay, please follow us on the RFS Twitter page. Keep up to date with SIR, and we look forward to another webinar series next month. Thank you.
Thank you, everyone. Have a good evening.
Thank you, Dr. Talk. Have a good night.
You too.